Hello everybody, this is Dr. Tika, MBBS MSANT, and today I have come with the yet video series, video number 4, with the topic being anatomy of the nose. We will discuss the nose by dividing it into two parts. One is the external nose and the other one is the internal nose. So first is the external nose. The external nose is pyramidal in shape, which with its base directed downwards and the root directed upwards. And the external nose is actually made up of an osteocartilaginous framework. That is, the nasal pyramid, it consists of an osteocartilaginous framework covered by the muscles and the skin. So let's discuss the individual parts. That is, the osteocartilaginous framework means it has got a bony part and a cartilaginous part. So first is the bony part. So the bony part it's the upper 1/3 of the nasal pyramid, while the lower 2/3 is cartilaginous. The bony part is formed by the two nasal bones which meet in the midline, and they are held in between by the frontal process of the maxilla and in upwards by the nasal process of the frontal bone. The cartilaginous part, the cartilages of the nasal pyramid, they consist of the upper lateral cartilage, the lower lateral cartilage or the alar cartilage, the sesamoid cartilage or the lesser alar cartilage, and fourth is the septal cartilage. So talking about one by one, first is the upper lateral cartilage. The upper lateral cartilages are two in number. They fuse with each other and with also the upper part with the septum, and the lower free edge of the upper lateral cartilage is seen intranasally as the nasal valve or the Lyman vestibuli. The upper lateral cartilage they extend from the inferior part of the nasal bones to the upper part of the alar cartilage. Each alar cartilage is U-shaped. It has got a lateral crust which forms the ala, that is the ala of the nose, and the median crust which runs in the columnar region, that is the medially, and merge with the septum. The lesser alar or the sesamoid cartilages, they are two or more in number. They lie lateral to the alar cartilage, while we need to know that most of the free margin of the nose is mainly formed by the fatty tissue and not the alar cartilage. The septal cartilage, its entire superior border runs from the nasal bones to the nasal tip, and it actually supports the dorsum of the cartilaginous part of the nasal pyramid. Here is a clinical importance, like for example in septal abscess or in during submucosal resection, during excessive resection, or if we do excessive resection of the cartilage, then that results in supratip nasal deformity. So the nasal musculature, which maybe helps in the movement of the ala, the nasal tip, they are maybe the procedures, the nasalis, the levator labii, superioris anaquinasi, the anterior and posterior dilator nerves, and depressor septi. The skin over the nasal bones and the upper lateral cartilage, they are mainly thin and they are freely mobile. However, the skin over the alar cartilages, it is quite thick and quite adherent, and we need to know that this alar cartilages, the skin of the alar cartilages, it contains the sebaceous glands, and that is why sometimes the hypertrophy of this sebaceous glands gives rise to a condition lobulated tumor, which is known as rhinophyma. That was about the external nose. Now we will talk about the internal nose. The internal nose is divided into two nasal cavities by the nasal septum, and it's the right and the left nasal cavity. Each nasal cavity communicates with the exterior through the nostril or the nares, and through the posterior nasopharynx, and with the posterior nasopharynx through the guana. Then each nasal cavity consists of two parts. One is the skin-lined portion, which is known as the vestibule of the nose, and another one is the mucosa-lined portion, which is known as the nasal cavity proper. The anterior and inferior part of the nasal cavity is known as the vestibule of the nose, and it has got it contains skin. It has got skin. It has got hair follicles and certain hairs, small hairs, which are known as the fibres. The furuncles mainly occur in this region of the nose. It is in the vestibule, and the upper part of the vestibule, it is limited by the nasal valve or the Lyman nasi, and nasal valve is an important structures in the nasal vestibule. And we also need to know the boundaries of the nasal valve. Laterally by the lower border of the upper lateral cartilage and the anterior end of the inferior turbinate, medially by the nasal septum and accordingly by the floor of the piriform aperture. Now, what do you mean by the piriform aperture? The piriform aperture is the bony framework of the nasal pyramid. Also, the angle between the nasal septum and lower border of the upper lateral cartilage is nearly 30 degrees. And this nasal valve is important because the nasal valve area, that is, it is the least cross-sectional area of the nose, and it regulates the airflow and also the distance during inspiration. Next, let us talk about the nasal cavity proper. So the nasal cavity proper, it has got four sides, that is the lateral valve, the median valve, the floor and the roof. So first, let us talk about the lateral valve. The lateral nasal valve is usually actually formed by the turbinates, which are nothing but three scroll-like projections, bony projections, and sometimes occasionally there might be four also. And these turbinates are also known as the concha. These concha are nothing but they are bony scroll-like projections and present in the lateral wall of the nose. And the area just beneath these projections are known as the meatus. So let us discuss the turbinates one by one. Turbinates or concha are covered by mucous membrane. The first is the inferior turbinate. So the inferior turbinate is a separate bone, and the area just below the inferior turbinate is known as the inferior meatus. Here, the importance is that in the inferior meatus drains the nasolacrimal duct, and the terminal end of this duct opening is known as is guarded by a valve, and this is known as the Hasner's valve. The middle turbinate is usually ethmoturbinal, that is, it is formed by a part of the ethmoid bone, and the middle turbinate, it is attached to the lateral wall by a bony lamella, which is known as the ground lamella or the basal lamella. Now, here we need to know that the middle turbinate, the attachments of the middle turbinate to the lateral wall is not straight. It is in an S-shaped manner, that is the posterior end of the middle turbinate. In its anterior half, the attachment lies in the sagittal plane, and it is attached to the pubiform plate. In the middle third, it lies in the frontal plane and is attached to the lamina papyracea. While in the posterior third, it forms the roof of the meatus and is attached to the lamina papyracea and to the medial wall of the maxillary sinus. As such, the ostia or various sinuses which drain anterior to the basal lamella, they form the anterior group of the sinuses, and ones which drains posterior to the basal lamella, they form the posterior group of the sinuses. Talk about a very important part, that is the area beneath the middle turbinate. It is known as the middle meatus, and this middle meatus, the structures which are present in the middle meatus, they are very important for us, mainly for the knowledge of the endoscopic sinus surgeries. Talking about the structures one by one. The answering process is a hook-like structure, bony structure arising from the ethmoid bone, running from the anterior-superior to posterior-inferior direction. The gap between the bulla ethmoidalis and the answering process is a two-dimensional space of 1 to 2 millimeter width, which is known as the hiatus separalis. The anterior-inferior border of the answering process, it is attached to the lateral wall, while the posterior-inferior border of the answering process, it is attached to the inferior turbinate, hence dividing the membranous part of the lower part of the middle meatus into two fontanelles, and these are known as the anterior and the posterior fontanelle. Now we need to know this fontanelle, they are devoid of bone and they are membranous, and when the perforation of this membranous part results into entry into the maxillary sinus. The upper attachments of the answering process, they show great variations in their attachments. It might be attached to the lateral nasal wall, it might be attached to the base of the skull, or it might be attached medially into the middle turbinate. Hence, this attachments, the variations in the attachments, they actually affect the drainage of the frontal sinus accordingly. Now, here is another term which is known as the infundibulum. So, which is the infundibulum actually? Infundibulum is the space which is limited medially by the arsenic process and laterally by the lamina papyracea. The natural ostium of the maxillary sinus usually opens in the lower part of the infundibulum, and sometimes we can also visualize the accessory ostia which are situated in the anterior or the posterior fontanelle. But the natural ostia is not easily visualized. Is the bulla ethmoidalis. Bulla ethmoidalis is nothing but it is an air cell or an ethmoidal air cell, and depending upon its pneumatization, it is either an air cell or a hard piece of bone. And sometimes there is a space above and behind the bulla, and which accordingly is known as the suprabular recess or the retrobular recess. Now, both of these, they combine together to form the lateral sinus of Grunwald. The atrium of the middle turbinate is a shallow depression lying in front of the middle turbinate. The agar nazi, it is just an elevation ahead of the attachment of the middle turbinate, and sometimes when pneumatized, it contains agar nazi cells, which are nothing but the anterior ethmoidal cells, and this pneumatization is sometimes they lie in the frontal recess area, and as such, this pneumatization may sometimes affect the drainage of the frontal sinus. Pneumatization of the middle turbinate gives rise to concha bullosa, and they drain in the frontal recess area and sometimes store the agar nazi cells. Header cells are ethmoidal air cells which are found in the roof of the maxillary sinus. The superior turbinate lies posterior and superior to the middle turbinate. It is also ethmoturbinal, and this forms an important landmark, mainly to identify the ostium of the sphenoid sinus, which lies just medial to the superior turbinate. Superior meatus is the area just beneath the superior turbinate, and it is the space below the superior turbinate where the posterior ethmoidal cells drain into, and the posterior ethmoidal cell varies from 1 to 5 in number. The Onodi cell is a posterior ethmoidal cell which may grow posteriorly as much as distance, and such that it lies by the side of the sphenoid sinus, and this is important surgically because the optic nerve might be closely related to the lateral one. The area just above the superior turbinate is known as the sphenoethmoidal recess, and this is the region or this is the recess where the sphenoid sinus opens. Sometimes there is presence of another turbinate which is known as the supreme turbinate, which lies above the superior turbinate. That was about the lateral wall. So now we will talk about medial wall. The medial wall is mainly formed by the nasal septum, and so we will discuss the nasal septum in detail. Now, the nasal septum, it consists of 3 parts mainly. That is the columnar septum, the membranous septum, and the septum proper. So, columnar septum, it is mainly formed by the, as I said, by the medial crura of the lower lateral cartilage, and they are united together by fibrous tissue, and they are covered on each side by skin. The membranous septum, it is mainly formed by a double layer of membrane without any bone in between, and this lies occupies the region between the inferiorly, the limit is from the columnar septum, and superiorly by the caudal end of the septum cartilage. Both the columnar and the membranous part, they are freely movable from side to side. We can move them from side to side. This part is the columnar and the membranous septum. The septum proper, it consists of the osteocartilaginous framework, again consisting of the bone and cartilaginous part, and its principal constituents are first is the perpendicular plate of the ethmoid superiorly, then the vomer posteriorly, and anteriorly by the quadrangular piece of cartilage, which is known as the septum cartilage. Other bones which has got minor contributions are the crest of the nasal bones, the maxillary crest, the crest of the palatine bone, then also the rostrum of the sphenoid, and also the anterior nasal spine. These are the minor contributions into the nasal septum. Talking about the roof of the nasal cavity proper, it is mainly formed, the anterior part is mainly formed, anterior sloping part is mainly formed by the nasal bones, while the posterior sloping part is formed by the body of the sphenoid bone, and the middle horizontal part mainly formed by the cribriform plate, which is a part of the ethmoid bone and which has got perforations through which the olfactory nerves enter into the nasal cavity. The floor, it is mainly formed by the palatine process of the maxilla in the anterior 3/4 and horizontal part of the palatine bone in the posterior 1/4. Osteomeatal complex, it is nothing but a narrow drainage pathway which links the anterior ethmoid sinuses, frontal sinuses, and the maxillary sinuses into the middle meatus. And this drainage area, it might be obstructed by certain anatomical variations, which might lead to the difficulty in the drainage of the maxillary sinuses or the frontal sinuses, and hence it is a very important anatomical region of the nasal cavity. The blood supply of the nose is richly supplied by the branches of both the internal and the external carotid arteries, and both on the septum as well as on the lateral one. In the nasal septum, the branches of the internal carotid system is the anterior ethmoidal artery and the posterior ethmoidal artery. Both are branches of ophthalmic artery. The branches of the external carotid arteries are the sphenopalatine artery, which is in turn a branch of the maxillary artery supplying posteriorly. Then we have the septal branch of the vestibule artery. Also, the septal branch of the superior labial artery, which is a branch of the facial artery. Lateral wall, by the branches of the internal carotid system, that is again the anterior and the posterior ethmoidal arteries, which are branches of the ophthalmic artery, and branches of the external carotid system. Posterior lateral nasal branches from the sphenopalatine artery. Then we have the vestibular artery, again the branch of exterior artery, or branch of anterior superior dental, which is from infraorbital branch of the maxillary artery, and the facial artery to the nasal vestibular area. Here we need to know an important region that is known as a villus area, and which is it's nothing but the arterial plexus, which is present in the anterior inferior part of the nasal septum. This is highly vascular region. Four arteries mainly anastomose in this region to form a vascular plexus, which is known as a causal plexus, which mainly contribute to this plexus are the anteropoidal artery, the septal branch of the superior labial artery, the septal branch of the sphenopalatine artery, and the vestibular arteries. And this is actually a wide vascular region, and this area is also exposed to the inspiratory current as it is present in the vestibule, and this is mainly affected by the fingernail trauma, especially in cases of children, and also a common site of epistaxis, a common site of epistaxis in case of children as well as in young adults. The venous supply is usually by the ventricular vein, and there is another plexus which is not uterus plexus, a plexus of vein situated posterior and inferior to the inferior turbinate. It's a site of posterior epistaxis in adults. Next, talking about the nerve supply. So first is mainly by the olfactory nerves, which carry the sense of smell and supply the olfactory region of the nose. These are nothing but 12 to 20 nerve fibers, nerve filaments, which end up in the olfactory bulb. These nerves, we need to know that they can carry sheets of pia, arachnoid, and dura mater with them, and so this might any kind of trauma might result in CSF, rhinorrhea, or meningitis. Nerves of common sensation mainly by the anteropoidal nerve, branches of the sphenopalatine ganglion, and branches of the infraorbital nerve. The autonomic nerves, that is the parasympathetic and sympathetic supply. The parasympathetic nerve fibers, they are mainly supplied by the medial nerve, and which mainly relay in the sphenopalatine ganglion through the superficial petrosal nerve. They relay in the sphenopalatine ganglion, and then they supply the nasal cavity, mainly the nasal glands, and control the nasal secretions. They also supply the blood vessels of the nasal cavity, and hence are responsible for vasodilatation as well. Sympathetic fibers, they mainly come through the upper two thoracic segments of the spinal cord, and they are mainly supplied through the deep petrosal nerve, which combine together to form the nerve of the thyroid canal or the biliary nerve, but they supply the nasal cavity without relaying in the sphenopalatine ganglion, and they are responsible for the vasoconstriction property of the nasal cavity. The lymphatics from the external nose and anterior part, they mainly drain into the submandibular lymph nodes, while the posterior part, they mainly drain into the upper jugular nodes, or sometimes from the retropharyngeal group of nerves. So thank you everybody.